Greetings everyone, this is Protap. I'm studying in first year mbbs from Dhaka Medical College. So today I'm going to discuss about the arches of the foot, the formation of the arches and the factors that are maintaining the arches. For explaining this, I've got an articulated foot that I'm going to use to describe the arches of the foot. So let's get started. So there are 4 arches in total. So I was saying that the word arch comes from archer. So archers used to hunt with bows. So bows are carved. So the word arch means carved. Okay. So there are 2 types of arches in the foot: the longitudinal arch and the transverse arch. The longitudinal arch are 2 in numbers. The medial and lateral longitudinal arch and transverse arch are also 2 in number. The anterior and posterior transverse arch. And let me show you here. So you can see the arch curvature. Okay. This is the lateral longitudinal arch. This is the medial longitudinal arch. And if I place the toe anterior posteriorly, you can see the anterior posteriorly, you can see the transverse arches. Okay. The concavity of the plantar surface of the articulated foot directs downwards. That means it's because of the arch. Okay. There are 2 types of transverse arches, the anterior and posterior transverse arch. I'm going to discuss all of these things. So what are the factors that maintains the stability of this arch? The first of all, I have said, so arch means this is an arch. Okay. So let's assume this is an arch of a foot. So what are the things that are making the arch? Various bones, articulations between various bones. Okay. So this is the tip of the arch. These are the 2 pillars of the arch. Okay. And let's see, to stabilize the things, I need close connections between the bones, right? So these are intersegmental ties. Okay. In the summit or the tip of the arch, if I suspend it with something, it gets the stability. So this is a sling. Okay. And these are the 2 pillars of the arch. So connecting the 2 pillars with this additional structure. So this is called a tie beam. So these are the 4 structures. First of all, the shape of the bone, the sling, and intersegmental ties, and the tie beams. Okay, these are the basic factors. So now I'm going to discuss the formation of the medial longitudinal, lateral longitudinal arch. So medial longitudinal arch, it contains 2 pillars. Let's assume this is the medial longitudinal arch. This is one pillar, this is another pillar. Okay. It contains 2 pillars, joints among the bones, right? These are the bones and this is the joints. 2 pillars, joints and a summit. So look at here, this is one pillar, this is another pillar. Okay, this is one pillar and this is another pillar, and this is the summit. Okay, and these are the joints. So the first pillar or anterior pillar is the head of first metatarsal. The posterior pillar is the medial tubercle of the calcaneum. The tip is the trochlear surface of the talus, and the joint are talocalcaneonavicular joint, which is a ball and socket variety of synovial joint. Okay. Now the lateral longitudinal arch. The anterior pillar is this, the head of the 5th metatarsal. Okay. The head of the lateral longitudinal arch, the anterior pillar is the head of the 5th metatarsal. The posterior pillar is the lateral tubercle of the calcaneum. Okay. And this is the summit of the arch, the superior surface of the calcaneum at the level of the subtalar joint or the posterior talocalcaneal joint. And the joint is this saddle variety of synovial joint. This is the calcaneocuboidal joint. Okay. Now the factors that are maintaining the arch. As I have explained, there are 4 factors: the shape of the bones, number 1, the shape of the bones, number 2, the slings, number 3, intersegmental ties, and number 4, tie beams. So you can remember it by this mnemonic: a sit, so sling, intersegmental tie, and tie beams. Now the transverse arch. Okay, factors maintaining the arches. So what is the sling? In case of medial longitudinal arch, there are three muscles that act as a sling. What are the muscles? Tibialis anterior, tibialis posterior, and flexor hallucis longus. Okay, let me show you this. Okay, look here. This is the tibialis anterior. This is the tibialis anterior. This is the flexor hallucis longus. This is the tibialis extensor hallucis longus. It also tibialis anterior. Look at here. This is the tibialis anterior. Okay, this is the extensor hallucis longus, extensor digitorum longus. Okay, look at here. This is the peroneus brevis and this is the peroneus longus. Look at here. This is the flexor hallucis longus. This is the tibialis posterior and this is flexor digitorum longus. This is the posterior tibial nerves and fascials. So this is one of the slings, flexor hallucis longus. Okay, and this is another sling. This is the tendon of the tibialis anterior. And look at here, this is the plantar surface of the toe. You can see the sheath of the tendon of tibialis posterior. This white tendon is the tendon of the tibialis posterior. So these three muscles, tibialis anterior, tibialis posterior, and the flexor hallucis longus, are acting as a sling to maintain the arch, medial longitudinal arch. Okay. Now the intersegmental ties. Intersegmental ties are the joints. So what are the joints? This is the talocalcaneonavicular joint. See, this is the head of the talus, this is the navicle, and this is the calcaneum, substanticular tali of the calcaneum. These two are connected by spring ligament. Okay, these two are connected by spring ligament, and this is the head. This resembles a socket, and this resembles a ball. So it is a ball and socket variety of synovial joint. Okay, the joints are talocalcaneonavicular joint and subtalar joint. Okay, intersegmental tie done, and the tie beams. The tie beams are the plantar aponeurosis, medial portion of the plantar aponeurosis, and the abductor hallucis, as well as the flexor hallucis brevis. These are the two muscles that act as the tie beams. Okay. Now I'm going to discuss about the lateral longitudinal arch, the anterior pillar. So look at this. This is the, let's suppose this is the anterior longitudinal arch. This is the lateral longitudinal arch. This is the anterior pillar, posterior pillar. The anterior pillar is this, the head of the fifth metatarsal. The posterior pillar is this, the lateral tubercle of the calcaneum. Okay, this is the summit. So summit is this. This is this, the superior surface of the calcaneum at the level of the calcaneonavicular. At the level of the subtalar joint. Let's suppose these are the bones and these are the joints. So what is the joint? This joint. What is this joint? Calcaneocupoid joint. What kind of joint? Saddle variety of synovial joint. Okay. The structures maintaining the stability of this joint. What are the structures? As I've said, SIT, sit. This is the sling, intersegmental tie, and the tie beams. Okay. The sling. What are the slings? The peroneus brevis and the peroneus tertius. This is the peroneus brevis, peroneus tertius inserts in this area. The intersegmental tie. Okay, the intersegmental tie. What are the structures that form the intersegmental tie? It is the joint. Okay, this is the joint that forms the intersegmental tie. And what are the structures that forms the transverse beam? The lateral part of the plantar aponeurosis and the intrinsic muscle of the little foot or the little toe. Okay, these are the structures that maintain the lateral longitudinal arch. Now the transverse arch. There are two transverse arches. This is the anterior transverse arch and this is the posterior transverse arch. As you can see, this transverse arch is incomplete. Okay, it forms half of a dome. So if I place two toes here side by side, I can see posteriorly there will be a full transverse arch. So anterior transverse arch, what are the factors, how are this formed? By the head of the 5 metatarsals, okay. And posteriorly, the posterior transverse arch is formed by the major portion of the tarsals and metatarsals, okay. Now what are the structures that maintain the anterior and posterior, both anterior posterior transverse arches? There are 4 structures, as I have said: sit, the shape of the bones, sling, intersegmental tie, and tie beams, okay. Shape of the bones, if you see the articulated foot, the shape of are like this, okay. The dorsal surface is extensive compared to the plantar surface, hence due to the more extensiveness of the dorsal surface, it forms a downward concavity of the plantar surface. This is one factor. Number 2, the slings. Medially, the tibialis anterior act as a sling. Laterally, the peroneus tertius and the peroneus brevis act as a sling. Let me show you the muscles. Okay. As you can see, this is the lateral malleolus, this is the peroneus brevis, and this is the peroneus longus, okay. And if you see here, the peroneus longus coats this along the plantar surface under the flexor digitorum brevis, okay. This is the peroneus longus, and I've shown you these things. The sling are done. Now the intersegmental ties. Intersegmental ties are the joints, okay, and as well as the dorsal interossei muscle. These are bipinnate types of muscles. These are the dorsal interossei muscles. Let me show you here. This is the first dorsal interossei, second, third, fourth dorsal interossei muscles. So these are the dorsal interossei muscles that act as intersegmental rim, okay. They act as intersegmental tie and maintains the transverse arch. Now comes the tie rims. Two things act as a tie rim: tibialis posterior and the peroneus longus, okay. The tie rims are tibialis posterior and the peroneus longus. So these are the structures that maintain the transverse arches. So I've explained the formation of the longitudinal arches, the maintenance of the longitudinal arches, the formation of the transverse arches, and the maintenance of the transverse arches. Now I'm going to show you some clinical correlations. Okay, first of all, I'm going to discuss a condition called flat foot. So why does flat foot occurs? So as I have said earlier, the plantar aponeurosis helps maintaining the longitudinal arches, right? So when a person stands for a long time, the plantar aponeurosis as well as the spring ligament gets overstretched. What happens? Then they cannot maintain the longitudinal arch. As a result, this happens, okay. This is called pes planus, or also called the flat foot, okay. A special type of gait is seen. It is called sluggish shuffling gait, okay. Now it can also make the foot more vulnerable to various kind of traumas. As you can know, the deep to the plantar aponeurosis, there are various digital nerves and vessels, so they can be vulnerable to various kinds of trauma. Now next clinical condition, it is called high arched foot. So high arched foot is also called the pes cavus. So why does this happen? Due to the adjuration of the longitudinal arch of the foot, which causes the pes planus. As you can see, the arches are more prominent than usual in this case. Now next clinical condition, this is called talipes varus. Talipes varus happens when due to the loss of eversion, okay. Talipes varus occurs because when the foot are inverted as well as adducted, okay. In this case, the person walks on this area, the weight transmits like this, okay. This is talipes equinus, like a horse. The calcaneum is above the ground. The person walks and the weight is distributed like this. The calcaneum doesn't take part in weight distribution. Okay, the calcaneum is always on over the ground. Okay, now this is yes, this talipes varus, foot is inverted. Okay, and this is the talipes valgus, foot is everted. In this case, the foot is everted due to the overactivity of the everter muscles and the loss in strength of the inverter muscle. What are the everters? The peroneus longus brevis and the tertius. When they become overactive, they can cause this kind of deformity. Okay, and this is this is talipes equinovarus. Okay, what is the talipes equinovarus? The foot is adducted, inverted, as well as it is in this case the foot is inverted, adducted, and you can also see to some extent this is plantar flexed. Okay, now look at this. This is hallux valgus. This happens to especially females who wear high heels, because this portion is, so the pressure on the hallux laterally is responsible for this clinical condition. The head of the first metatarsal is prominent, as you can see, and there is a formation of a bursa. This is called a bunion. Okay, now hammer toe. So we can see there is a hallux valgus as well as a hammer toe. So this is hammer toe. Why hammer toe? Because all of the interphalangeal joints are hyperextended, but the proximal interphalangeal joint is acutely flexed in this case. Okay, the proximal interphalangeal joint is the second and third toe. We can see they are acutely flexed, and others are extended, hyperextended. We can also see the person has a bursa right here. It's the bunion, and hallux valgus is also seen. So most probable cause is maybe this patient is used to wearing high heels, which may have caused this kind of deformity. So these are all of the clinical conditions that should be discussed. So let me recapitulate. First, the pes planus, also known as the flat foot, pes cavus. Okay, more prominence of the longitudinal arches due to the adhesion of the longitudinal arch. Okay, this is this is talipes equinus. Okay, this is the talipes equinus, and this is talipes varus. This is talipes valgus. This is talipes equinovarus. And this is hallux valgus. This is hammer toe. Thank you for watching this video.